Hi, I'm Dr. Meredith Warner, and I'm an orthopedic surgeon, and I want to talk to you today about berberine. Berberine is a natural way to increase Ampk in much the same way that metformin does. And we talked about before how metformin is being taken in the anti-aging community. There's actually a huge study the NIH actually funded called the TAME study, and it's a metformin as a age management drug. And the reason this all started is because more and more studies were found looking at diabetics and noting that the ones that were on metformin did better in every parameter. So they had less cancer, they had less heart disease, they lived longer, they had less arthritis, they had less pain, they generally felt better. So metformin was some kind of wonder drug that's just been under the radar for about 60 years. And then people started to figure it out. And it does this because it improves mitochondrial health, because it upregulates Ampk. So it's like a fasting mimicker, right? So if you calorie restrict, your Ampk is going to go up and you're going to induce sirtuins and the cleanup processes of the cell and DNA repair and whatnot. Metformin does the same thing. Well, guess what else does it? Berberine. So this is a substance that is natural and is almost, in its effects, almost identical to metformin. So berberine will lower your cholesterol, just like metformin has been shown to. That was reported in 1989 first, and then in 2004 it was shown in real life. It lowers your LDL levels. So why does everybody, the number one prescribed drug is statins, right? Berberine does the same thing. It lowers your total cholesterol, lowers your triglycerides. Guess what else lowers your triglycerides? Omega-3s. It activates Ampk, which means it's going to improve the bioenergetics of your cell, and then by virtue of activating Ampk, it's going to activate the sirtuins, which are going to help with the DNA repair and DNA methylation or deacetylation, and it's just going to make everything work better for you. And then, of course, because it's acting like metformin, it's going to lower your serum glucose, so it improves your insulin sensitivity. So like people in PCOS, things like that, where they have insulin resistance, or people with straight up insulin resistance, berberine is probably a good product to start with. And so because of all that, of course, it's going to help with weight loss. So I've actually prescribed metformin, and I've tried to prescribe other drugs like the GLP-1 inhibitors or Ozempic, things like that, to help people with weight loss. Because if you can just get your body into that stress state or pull the glucose out of the blood and get it in the cell and start getting it to be used as opposed to going to forming fat, people will lose weight. So a lot of work is being done looking at berberine as a weight loss supplement. But of course, you can't sit on your couch and eat Cheetos till midnight, wake up at 6 and not exercise, and then expect to lose weight just because you take berberine. It works better with a good circadian rhythm, a better diet, and a little bit of exercise, obviously. But guess what? Every single drug that's approved on the market for weight loss, the labeling always says with a good diet and with exercise. So I love berberine. I think it's great. You do want to start off slow with it and probably talk to your physician, because some people, it really controls blood glucose so much that it just makes them, they have to get used to that. So it is a potential diabetes treatment. There is a 2014 study looking at it for that reason. A lot of people will take it after a meal, particularly a meal that they know will spike their glucose. And again, when I say a lot of people, I'm talking about people heavy into wellness and anti-aging. And essentially it's comparable to metformin. So berberine is a great longevity molecule because it's going to increase your Ampk, which in turn will increase your SIRT.